system.
I don't care what the hell it's not.
I want to go down there and show you try and find out. It's like, it's much better than that. It's like, if we have it's kind of like, showing own the service. It's actually investing in it as part of our strong package. But yeah, we gotta get all that in 30 minutes, so.
Yeah.
I wasn't sure if this was gonna be a time.
You ain't never gonna be able to work that home. Our kids don't, if they don't work, we took them down. Hey, sir.
Well, you got already put up great sport, and then go back.
My class, we met at Dunkin' Donut this morning for something, a brief meeting. I tell you, we got some real men in our class.
Andrew.
The first item on the administrative physical matter is Baldwin Transit. Do you have any information you can?
Yes, sir. Our finance officer, she has been ill all week, so she
Okay.
is not here today. I had requested Mr. Trumbo and the dispatcher to be here. I see the dispatcher. And as we discussed previously in a couple meetings, when I first got here, we were having a discussion regarding the amount of funds that were received in the finance department was approximately $7,500, and according to when the fee structure changed, that equated to about 2,500 trips on average. And then subsequently, I sent you all an email that I received from Mr. Trumbo that there were 5,100 trips, 3,000 of which originated or terminated inside the city limits of Milledgeville.
3,000? And I did reach out to the mayor, but I didn't get any response that they want to meet with us, so.
So the decision that you tabled till this point in time dealt with the fact that the grant has expired. We are now paying for this with county funds. And I don't know anything about Q-Ride, our dispatchers here. If you have questions as to the Q-Ride information. But that's all I have, sir.
So you're saying up to year to date, we only received $7,500, if don't hear me correct, so far this
Now,
year?
well, it was year to date when we did this, a couple weeks ago.
Maybe 8,000 now.
8,000.
I have, go ahead.
I was gonna say, Mr. Chairman, I do have a few questions.
Yes, go ahead, go ahead.
Go ahead.
So, just to clarify information that I have, and maybe might be for the dispatcher or you, Paul. My understanding is what you sent us was 5,100 trips, but the money that was taken in was about 3,600. If you divide the money by $3 per trip, am I correct?
Correct.
Okay. In the 5,100 trips, that was the Q-Ride data that you sent the entire commission. There was, a lot of them had $0. Thank you, Jalen. So on the Q-Ride data that you sent the commission, as you look and you see all the appointments or the scheduling, there was $0 by a lot of them. Are those, just in reading it, I just interpreted that may be a cancellation. And so that might be a question for the dispatcher, is that why that trip has $0 by it?
That would be a dispatcher question.
And so, which would further answer the question, are the numbers that were given, is that everything that was booked, not removing cancellations or anything like that, or is that actual number of trips?
I'm going off of what we actually received cash in hand. So you're right on it at, 3,000, whatever trips.
3,600, I
Yeah.
believe. So that, I put that question out there for probably whoever's the appropriate person to answer.
Right, we got to wait till everybody get through asking questions? then? Okay,
I might not, that might solve my problem.
okay.
Okay, so with the $0 that you was talking about,
Yes, ma'am.
Would you state your name, please?
Shanerica Waller. The way that the computer how it generate is certain things that I can put in, and it's certain things that I can't put in. So it has to go directly from Q-Ride, and it has to be someone above me. But we can put the numbers in after we put the miles in. So when we do it every Monday, we count the money, and we get the receipt every Monday. So yeah, with the $0, it's like I can, but I can't. It's like I said, it's above
Yes,
me,
ma'am.
and I can't do it.
Well, and I guess what concerns me is if we have 51 trips, we're only paid for 3,600.
Gotcha.
And I'm hesitant to say, I mean, I don't want to be accusatory of any mishandling of money.
Gotcha.
You know, so
but
please,
like I said,
please,
like,
by all
I mean,
means,
we have our receipts. We get them.
Sure.
We get our receipts every Monday. We count it, and what we get, we count over sometime $800 a
Yes,
week.
ma'am. Yes, ma'am.
See, but are you through, Commissioner?
Yes, sir.
See, that's
thank
kind
you.
of confusing, and that's when we have to be driven off of analytical and numbers, when the numbers ain't matching up, when they simple math, 5,100 trips, time 3. I'm looking at that as a commissioner, I'm like, hey, something is definitely wrong with this math here, so
Gotcha.
I just want somebody to explain to me now, how do 5,100 trips turn into only $3,600? When it shouldn't be.
Yeah, it
It's gotta-
should be way more.
It's gotta be somebody not paying, some money is misappropriate.
And Mr. Chairman, to kind of, when I did an average of the money received versus tripped, I think it was reported 21 people on a bus, 5 buses a day. The money averages 15 and a half people a day is what the money that we're collecting averages out to be.
All right.
Commissioner, let me shine a little light on that. Good morning, everybody.
Good morning.
I'm Craig Pearson. I'm the senior driver with Transit. This, what you talking about down here, would say 17 trips, and over here will say fare, it says $0. That's something Q-Ride, that's why she can't do it. That's something Q-Ride in the system. Q-Ride has to generate that in the system. And you all are correct, exactly correct. When it says 20 trips, whatever the trips may be on the outside here, it should be a dollar amount right where those zeros are. But she can't go in and do it. That's something Q-Ride will have to go in and do. But it's supposed to be on there. Y'all exactly
Of course.
right.
Right.
For you be able to see, okay, this Craig's manifest for the day. Okay, also, I'm stepping on you.
Okay.
When it say 17 trips, they got, the fare is supposed to be right there beside it. Where it say
Okay.
You see what that is now? The dollar amount's supposed to be there as well.
So, yeah, so that would be, it says 20 total trips, that would be
At $3.
60 bucks, right?
That's right.
Okay.
Even if it's a cancellation throughout the day, when we go in there and put a cancellation in, that system should subtract those $3 as well.
Exactly.
Yes, sir.
So when we turn it in, those $3 automatically should drop off that computer off of Q-Ride. Now that's something that who's ever over transit supervisor, whoever. Right now we don't have a supervisor over transit. They're supposed to go in and to talk to Q-Ride and let Q-Ride make sure Q-Ride got it in the system. That okay, when a cancellation is made, that $3 automatically drops off there. So when y'all ask for this, y'all can see, okay, we had X or Y, Z amount of trips. Then that's the correct dollar amount right there. That's where the confusion is coming from.
Yes, sir.
Because you see, I'm like y'all, you see all zeros now, I'm like, okay, we calculate this right here, some of this ain't adding up, some of
That's
this ain't
right.
counting up.
That's right.
And not just this manifest, it's all the manifests like that.
Right.
So that's something Q-Ride will have to fix. You want to say this out?
Yeah.
Yeah.
But also what confusing to me, Mr. Pearson, is that I'm getting information said that 5,100 trips. When I multiply that by 3, either I'm doing some math wrong or the numbers ain't adding up. That should be like $15,000.
No, but see, the cancellations ain't kicking out, that's another, back to Q-Ride again.
Okay.
It's not generating the count of cancellations.
Right.
Even,
You're not
It's-
really drawing that many people.
No, we,
even if you do 3,600 people, if I think what Commissioner Hall, Commissioner
Little.
Little said that it's 5,100, but it's actually about 3,600. If you multiply that times 3, it still should be roughly $10,000.
okay, but my question is, if we're turning in this money every Monday, we're bringing it here.
Okay.
So where's the receipts on our behalf from here? Because like I said, I have all the receipts on from January the 1st up until today.
You don't get a receipt from,
No, I that's what I'm saying. I have all my receipts, but if I have them, where is it? You get like where is it for? No, where
No,
is
I
it?
think what she's saying is they give you a receipt
Yes.
and
so
you're keeping your copy.
I'm keeping my copy,
Okay.
but they also have a copy too.
Yeah,
So
because
are
she
they
turned it
turning
in.
it in to y'all so y'all can see
I
it?
assume in order for the county manager to give me a $7,500 dollar amount for the year, that somebody getting some receipts or some money, but
I got a question too. I'm not accusing anybody.
me either.
Oh yeah, no,
Me
I
either.
know.
But I don't understand clearly. I hear what you're saying about the computer and all that, but that sheet we had some places that had $3 by it, others had none. So how'd that $3 get on there?
I mean, like I said, we have to put it in. Every day we put it in. We have to put it in, but it drops off, and that's something that I can't control.
It
That's
drops off.
Q
Why does it
rides.
drop off?
Now that I
So
can't.
You're telling me that let's say that sheet had 10 names on it, and 3 of them paid and 7 of them didn't. Those 7 just dropped off, and the other 3 didn't.
No, okay, so
None of it's
basically-
cancellation.
I basically trained myself, so I'm still learning with Q Ride. So I mean, the more that I can learn with it, then I can understand better. But like I said, some of the stuff I don't.
I have a question,
It's
Mr. Chairman.
Of course, long and short of it is, if it's 5,600, 3,100,
Or
6,000
Gotcha.
people riding, it's still not affordable. We're paying how much?
The money ain't adding up.
37,000 a month.
37,000.
37,000 a month. I believe that's I think that's, my understanding, that's the value of the whole thing. I think that is not counting what the grant money would pull away. Would that be correct, Paul?
I believe that you're correct. I believe that's 50% on us, 50% on the state.
So we're paying $17,000 a month out of the county, and we're not making $17,000 a month.
Well, and then right now it's $37,000 a month on us.
Yeah,
On the county.
Because we
Because
don't,
we're paying 100%.
Yeah, yeah.
The
and
long and short is, I don't see that's affordable. I mean,
But, man,
yes, yes, ma'am, go ahead.
you made a comment earlier that you can, but you can't.
Right, it's certain
Put
things that I
in, so-
can do, but then with Q-Ride, like, it's certain things that I can do and it's certain things that Q-Ride have to do.
And you also made the statement that you don't have a supervisor now. So how
I-
long have you been without a supervisor over transit?
Be honest, it's been a while.
Right.
Okay,
It's been-
I
it's
mean,
been a
I
while,
thought
to be
they were
honest
supposed
with
to
you.
be here,
Ain't time to sugarcoat nothing.
but he's not
It's
here.
been a while.
And
We
see,
have overseen him.
with me having a supervisor, I supposed to went to classes so I can learn more of this stuff. So when it come down to the questions, I can better answer them and I can know what to do.
again, I wanna go back to where I was. No criticism of any of y'all.
Yes, sir.
At $37,000 a month,
Mhm.
and we're only bringing in less than $10,000 a month. It doesn't matter what kind of job they do, unless we have more riders, it's not affordable, period.
Well,
the money is not adding up, and that's what we need to.
And if the
It
data,
can't it can't add up 37,000.
And if-
We have to have a bunch of people riding.
Yeah, I know, but still,
if the data we were
Something
given
missing.
was correct, the best year thus far was 11,000 rides in '23. And that would constitute, am I right, would that be $33,000?
Based on $3,
So $33,000 for the year versus $37,000 a month.
which would be 17 if we had the grant, if we were getting the grant, but,
if they had the grant.
right.
You gotta have $12,000,
Right,
over
right.
12,000 riders a month to make it break even.
Well,
and we don't know that it's not.
and if it's other things we could,
Well, we don't have the money to show for it.
well, there's other things we could be
So
doing
we don't know.
if we were getting the grant portion of it, we could maybe get rid of one trip to bring the cost down, and increase the rides that way with them,
We also, since the last time we had this meeting,
right?
we, and I mean, when I say we, we're all on the same team here. Baldwin County Commission, we're on the same team. We did say that we will come back and discuss this in 30 days. To see what can we do to try and save this for the people. The good people of Baldwin County. Okay, what we have done, transit, what we have done, we have went out and got more riderships. She also got contracts with LLC people. She also got a contract with Bostic for more riders. The school is coming back in. The teachers are going back to school. We got a lot of them. Our ridership is up.
It really is.
It
And now
really
I'm able to do the on-demand trips. So if someone call today and they need a trip, we're able to get
Get them
them
that's way.
the same day.
The same day.
So,
Well, we used to didn't do that.
yeah, we used to couldn't do it because we
Right.
didn't, but now we got
now
them
we can
extra
do it.
2 vans, so we can do it.
Yeah.
So,
Okay, and one other question I have, are you through, Mr. Pierce?
Yeah, and like I said, she got the ridership up. We got more people riding. We got more contracts than we ever had before. And we're not stopping there. We continue to go out and get new riders because that's what the county needs. The people need transit. Everybody just
Yeah,
don't have
it's a
cars.
need for it.
And the other family members, they tied up with their jobs and stuff. They can't get their family members back and forth to Dallas and to the council center. And I understand what you all saying about the money. Everything comes always back to that dollar. About how sustainable can we fix it because we don't lost the grant. Like I said again, I say we. We don't know, we're on the same team. But what we need to do, since we've done that, let's take some of this negative energy and put it a positive energy to try to save transit. That's what we need to be focusing on right now. We need to try to save.
'Cause, I mean,
things.
our main
You know.
focus
I have another
is the
Yeah.
community, to make sure that we get our dialysis people back and forth to dialysis, hospital, doctor visits.
Cancer center.
Can you give me an estimate of how much your ridership has increased?
I can have that to you by the end of the day.
No,
I know,
I got
yeah. Oh, she got it. She have it right now. Yeah. Because
Okay,
Do you
so,
have a contract like with Bostic?
yes.
I mean, are they charging at least $3 a person?
Oh,
We
yeah.
charge $3 a
oh yeah,
person.
everybody.
Even with the LEC,
Yeah.
we charge them $3 a person. And with that, with the LEC, we have at least 8 of them that we pick up every day. So,
And that's picking up and dropping off.
yeah,
And
picking
that's
up and
gonna
dropping
be
off.
Yeah,
part
that's
of my
big one,
question,
double.
Mr. Hall.
So
You said when you finish.
since last month, we done picked up 183 more people.
And you're anticipating it's gonna go up higher when the school open back
Mm-hmm.
up?
Oh, sure, without a doubt.
It already
No, no.
it done already started.
This is a question for county manager. Is it a way we can do, like with Bostic and other things, period, a cashless system? Is that possible to, when you get, like, in Atlanta, Martin, I think you have a card, you can,
How does Bostic?
I went to a meeting in Sandersville, and some of the transit they are like that, but we're not like that yet. But like I said, I gotta have that proper training so we can bring it in.
How does Bostic pay? Did they just write you a check once?
No, they do cash.
They do cash.
no,
We
we
do
need to
every
change that. They
Tuesday
need
and Thursday.
They need to write checks to
Write
us.
checks, yeah.
Yeah.
Well, at least some
Well,
at LEC, they write
It might be
checks.
individuals though out there at Bostic. It might
Yeah,
not-
it's
It's not
individuals.
really Bostic doing it, it's the individuals doing it.
Are you taking inmates that are in Bostic places, or are you taking employees, or both?
No, we're taking the inmates
They
in Boston.
inmates. Yeah.
They go to Walmart or either every month they do a outing. So
And Paul, I got one question for you. So we can't, the grant is gone for this year, right? If we get our audit, could we go back and refile for this grant, or is it just automatic gone for the year?
We're automatically out for the year. We lost LMIG money as well to the
Right.
tune of about $850,000, so it's not coming back.
I'm not real good at math, Paul, you are, so help me out. All right, even if we had the grant, the grant amounts to what? How much was the grant?
50%.
So it'd be about,
So even, all right, that means we gotta be
About
making
18,500.
about $17,000 a month.
about 18.5.
It's pretty,
$18,000 a month, and we're now making, how much a month?
7,500,
The numbers are so over the place, I don't know what we making, so.
7,
8,000.
5 and 7.
Right.
So we're still a long ways from, having enough, to pay for it, even if we have the grant.
Do you have cameras on these
Yeah.
trains?
Yeah. And like Commissioner Bud stated, the numbers is all over the place because, once again, if you don't have an overseer over your ship on a daily basis, you're gonna have stuff all over the place.
right.
Transit need a transit supervisor. Someone is gonna be hands-on with transit, know what's going on with transit at all times, especially with this money situation, especially with this ridership situation. If you got somebody overseeing this operation, I guarantee you it'll be better. Then your numbers won't be all over the place. Like I was telling you about the trips down here and the dollar amount, what it said the fare, it says zero. That shouldn't happen. I'm gonna be honest with you. That shouldn't be. When we get together with Q-Ride, you let them straighten that system out. So when you do see this again, the dollar amount will be here, the trips will be here, and you'll know what we got. Even with the ridership going up, I can promise you guys, it'll be a lot better. It'll be a lot better. But if you just got a bunch of people just running something, and you don't have an overseer, I guarantee you're gonna have a problem. Because those people are gonna just feel like they do what they want to do. I don't have to answer to nobody. Can't nobody tell me anything. But if you got an overseer and gonna make sure that the I's are dotted and the T's are crossed, this program will be a lot better. This is a very important program. This is not as a program that's out here one of our entities. It's not. This is a very important program. And to see it go will be heartbreaking. Not just for me. I'm gonna be okay.
Yeah. It's
But for the riders,
our riders.
but for these riders, it's not gonna be okay. It's not gonna be okay for dynasty folks to miss appointments. I don't want that on my head.
I mean,
I won't be able to sleep at night.
we still got people
Yeah.
that's booked up. I got people that's booked up probably to the end of next month.
But, all right, and I don't disagree with the thing you said. I agree, and I've said ever since I've been on here that transportation's important. And I've said it's been needed. But I've also said it's not financially feasible at the way it's going now. In order for us to save it at $37,000 a month, we gotta have about roughly 12 and a half to 13,000 people riding it a month. And we're not close to that. We're not even halfway there.
Yeah.
So how would you explain that if that was coming out of your pocket, that you had to pay that kind of money when something's, how can we do that?
And it is kind of coming out their pocket because
Yeah,
they're
they-
taxpayers.
Yeah.
It get kind of paying taxpayer money. Yeah, it is coming out of their pocket.
How can we justify?
I see where you're going, Commissioner Hall. I see. Yeah.
I have no problem justifying, because some things,
Because
some things you have to morally justify. I
Yes.
think this is a morally needed thing that we need to do and should be able to provide for this service. And continue to try to bring those numbers down, close, maybe go up, maybe get rid of one van or come up with ideas to bring that cost down lower and lower, $4,000 or $5,000, to within the $4,000 or $5,000 range, come up.
and also,
Hey, we ain't making
you're right.
money out the recreation department, but we ain't gonna close it down, so.
Right, we're
Right.
not
We're not
gonna
gonna
close
close
it
it
down.
down, so
We're
it's
not
a
gonna
lot of
close it
things that
down.
taxpayer pay for that, don't suffice itself. There's a lot of services
Even
they
looking
need.
at this here, we don't go out of town. We don't do out of town trips.
Right.
Why not?
Exactly. Why
That's
why
why-
can't
not?
we do
And
it?
by the way, I thought we had a supervisor, but I was told, I was under the impression that we had a supervisor
He's
for
not here.
transit. So I don't know, this
Why
even,
not?
Yeah,
We
it
this
is
just-
even,
us here.
Yeah.
new to me hearing that, cause I thought we had a supervisor.
Mr. Trumbo was
I
That's
thought
what
it
I
was
thought.
too.
sitting back there.
Oh.
Okay, but anyway, that's a,
Well, we-
Well, one of the reasons we didn't go out of town was when we were only running 2 buses.
Oh.
Now that we got 4 buses, that,
Like, could we do
what
that?
do we have to do? What,
Yeah,
cause I don't.
Like, see, can
I-
we do that? Cause we
Yeah.
don't mind doing that,
Well, Carl, what would this board have to do to maybe for start going out of town?
sir.
And how much would it cost?
Cause we have
Cause we'll have more riders.
we have more riders.
Cause we
But
can
you also
go
have
out of
more
town.
costs.
Well,
Yeah.
you cost,
Right.
also
Yeah.
costs more.
Now
Well,
the
you know you're
cost
not
won't
gonna
be
ride to
$3.
Macon for
I was gonna say, cost won't be $3 to go to Macon now.
Of course.
Yeah.
But the
Right,
cost
right, no.
But the
Augusta,
cost to
wherever
get to
they need to
Macon.
go.
Yeah,
Right.
yeah,
That-
we need to go.
Yeah.
Round trip,
Yeah,
yeah.
but I'm just
And
making sure it is not gonna be $3.
we need to
Yeah.
have a different way of collecting. Anytime anyone's collecting cash, anything is possible. With anything, you can finagle cards. But we just need a better system, I think, of collecting the money, something different.
And like I said, they do have a system like that. They do.
Well,
Q
we'll
Ride
be looking
do.
at that also, and also, I'm all right with y'all collecting cash, but that manifest gotta line up with the cash that day. That's
Exactly.
where my concern come in with
Gotcha.
that. And I'm not
Yeah.
accusing nobody of doing anything fuzzy, but, I
You gotta line up.
I gotta go
Yeah,
off
Yeah,
the
you-
numbers.
you
I gotta
are
go off the
absolutely
numbers.
right.
It gotta add
like,
up with me.
like Commissioner Little said, it gotta line up. It needs to line up.
Right.
It really does. And I know it can happen. I know it can happen. Because, like, once again, the people need it, man.
I understand.
And Commissioner Hall, I agree with you. You know, the numbers ain't lining up, but the numbers can line up. Just because they're not lining up now, don't mean they won't line up. They can definitely line up.
That's what we need to work
Yeah.
on, because transit is
Yeah.
so important. Oh
It's
my
very
goodness.
important.
Mr.
So
Chairman,
important.
I have a question.
Yes, sir.
So is it that the ridership numbers are inflated or the money is missing? Which one is it?
The money isn't missing. The money is there.
So the ridership numbers are incorrect.
Well, they're not inflated. The numbers go down like in the summertime. The teachers is out, when school go out, the teachers is out.
No, but you see, we have an issue here where the ridership numbers don't reflect the income. So one of these numbers has got to be off. It's either we don't do as many rides as we claim we do, or we don't have the money that we should have. Do y'all disagree with that?
Yes, I do. Wholeheartedly, I disagree. Yeah, I disagree.
And do you have numbers to justify this?
Like we said, the ridership goes down sometime in the summer. Depends on whose goes out. When teachers is out, the kids is out. Cause we ride Georgia College students as well. When school is out, the numbers goes down. Yes, the automatic goes down. No doubt about that. It goes down.
But that shouldn't change the fact that if you do one ride, you should have $3. If you do 10 rides, you should have $30.
True.
But these numbers are not matching up. So we either are counting canceled rides as actual rides, and we don't have money to prove for it, which Commissioner Little
Well,
went down that
That's why I
road.
said that's in Q ride.
once again, that's in Q
In the
ride.
cancellations, that's something that I can't do. I can't handle that with the cancellations.
And part of this is not, is not, I don't feel like would be your responsibility. But when you come and turn in money, this should be reconciled then. So that when you leave there, you know that we did this many rides, and this is how much money I'm giving you, right? And then you walk away with a receipt, and that's all reconciled. You have everything, but that's not happening, and I don't feel like that's your responsibility.
what yeah.
That's our office's responsibility.
And that's why I was
Yeah.
asking, like, okay, so who is reporting into who? Because, I mean, I do my part on my end,
And if
but,
there's a discrepancy, it needs to be worked out on Monday when you turn the money in, right?
right.
Okay, so then I have another question. When you collect money for a ride, say somebody calls you, and I know you had, I think it was 24 hours in advance, somebody had to schedule a ride or whatever. So let's just say that happens. I call you and I say, hey, I want to go to wherever, X, and you're going to come and pick me up at 9 a.m. When does the money transaction occur?
When they get on the van.
When they get on the van.
Okay, so it's not, so it's really not prior to you showing up.
No.
You show up and then you collect money and you'll take cash.
Yeah.
We take cash
Yeah.
and we take, and then is there another method of payment?
It's just cash.
Cash only?
Yeah, we don't use cars and
But
nothing.
like I said, I mean,
Yeah.
it is a system that we can start
Right.
doing.
Yeah.
It's a tap pay, and it's another system.
We shouldn't even be going to somebody's house until we have $3, in my opinion.
Commissioner Strickland, let me add this to you. You're exactly right. You said you wait till Monday and tally it up. I would go as far to say on a daily basis. When we leave there, when we come in, when that bus 21 comes in that office, we'll sit down and tally up what Craig just made on that bus 21. Okay, she gets it. She tallied it up that day. Not waiting till Monday. So when somebody did last Tuesday, that day, when she tallied it up, we put it in an envelope, we seals it up. So when Monday comes, she get all of the envelopes. She get all of them and then tally it up. Who to say Craig didn't get XYZ out of there before anything? You see what I'm saying? You see what I'm saying?
You're holding-
so
you're
it
holding
needs to be
cash
tallied
right.
up on a daily basis.
It ought to be done on a daily.
On a daily
yeah.
basis.
And turn
Yeah.
into us on a daily basis.
Yeah, I think that's what he's saying.
Yeah,
Yeah,
that
on a
too.
daily basis. And then, like Commissioner Butt said, then these numbers won't be all over the place.
All over the place,
Won't be all
right.
over the place, because I don't want to claim nobody mishandling the money, because that's not what we're here for. They claim somebody doing something frivolous. That's not what we're here for. We're here to try and work as a team, to save transit. Whichever way that is, we need to work together and try and save transit. And whatever we need to do, it was back to start going out of town, picking up trips, because we get calls all the time. People need to go to Macon. We can schedule one of those buses to go out of town, or schedule 2 buses to go out of town, because Baldwin County don't have a wound center. We have a lot of wound victims in Baldwin County needs to go to Macon And Macon and Atlanta only got a wound center. And unfortunately, we don't have one, but they call us to see that we go out of town. I had somebody want to call you yesterday, want to go to Athens.
And see, that's what I was getting ready to ask
You don't want to go to Athens, that was just yesterday.
Why just Macon and Atlanta, why not? I see transit when I go up to Augusta, Hospital, it'll be people all the way from Jefferson County, Putnam County, they up in. So,
Yes, yeah.
so we as a board, if we decide.
Yeah,
to
that'll
keep
be
this,
on
or
the
decide
commission,
how
that'll be on
we'll
y'all.
go with these trips.
Yeah.
If one person calls and says, hey, I need to go to Macon to the wound center, are we driving that van with one person?
No,
Or do we tell them no unless
Well,
we have a
yeah.
minimum people?
Right.
And what I'm looking at here is the cost of
one
going to
trip.
Macon and coming back, pay for the driver, pay for the fuel, pay for the insurance, all that stuff to do that, for one rider to go. Then, while I see your point of being able to go out, we can collect more money, but we're also creating more cost.
Okay,
And so does that work against what you're trying to accomplish here?
No, because I'm gonna throw something to you that.
Yes, sir.
That just happened just yesterday. I picked up a young, a guy over there in Greystone. And took him to the, doctor. Soon as we got him back home, his wife say, oh yeah, do y'all go out of town? I said, no, we don't go out of town. Wait, he got to be in Athens Friday to go to the wound center. Which I said, let me see can I find another transit for you, because I know we don't go. But they asked for Commissioner Butts at first. Marcus Johnson, asked for him. She called me back and said, yeah, because I just called 2 transits. One of them said they'll come get him and take him for $1,126.
Wow. That's
And
probably
the
what it
next-
cost
and
us.
$1,126. Now that's worth a round trip to go to Athens. The next one she said she found was for $785. I'm pretty sure they went with the $785, but that would be worth it.
Yeah, it would be
If we had
Yeah,
just
yeah.
one person to go, hopefully it would be more. But we just said we had to make that one trip, and for one
All
day.
right, but the argument here is that we're providing transit for people who can't afford another way, and now $700 is affordable?
No, they'll use
Insurance.
Medicare.
Oh, okay.
They'll use the Medicare.
Or Medicaid.
Medicaid, yeah,
I got
that's
you.
right,
Insurance
Medicare.
I got
pays for
They
that,
use
yeah.
that, and they pay it. They
Yeah,
pay it.
insurance
Gotcha.
pays for
Yeah.
that,
See, we need to expand.
Right, because
That's what we need to do.
yeah, we need to
expand.
start using,
Yeah.
being able to use the insurance.
Which,
Yeah.
Mr. Chairman,
I
if you remember in our last meeting, we discussed the fact that Medicare and Medicaid will pay for these dialysis trips. They'll
Right.
pay for trips
Yeah,
to
they
the
will.
wound
Yeah,
center.
they'll pay.
Because I got a lot of people that call and ask
But
us.
instead of utilizing those resources, what we've done is we've stepped in and say, hey, I'll show you how to lose some money. And we're doing something that a service is already paid for through Medicaid and Medicare. I mean, it's paid for. And so, and I'm not saying that those are tremendously efficient resources. I know they're not, but neither are we. And so I don't, for us to charge one rider to go to, look, for a private business, to charge, like you said, to take a person to Athens, that's what they're paying, that's what they're charging. And so now they make a little money on the side, so let's just say they're making $100 off of it. We gonna charge $600 to break even on that? To take one person in a bus made for 15 to Athens or Macon? Those numbers are never gonna work. We're losing, it cost us what, $30 to take a person on a ride. If you take all of our expenses, if I remember right on the spreadsheet, it was roughly $30 a ride is what Baldwin County taxpayers are paying. If we expand a service that's already losing that kind of money, those numbers are gonna go from 30, 50, they're gonna start climbing because we're gonna lose more and more. And I don't see it as feasible.
We did it with the golf course, track man. It's supposed to cost $148,000, ended up costing upwards of $1 million. So we did it with that. That's what I'm saying. This is not the only thing that services we running in Baldwin County that we don't make money off.
But this is a
The golf course
duplicative
breaks
service.
The golf course has broken even since COVID.
It has, you can't
Those
break
numbers don't
even.
add up to me.
Yeah, it
What
can't
they
really
said,
break even.
$700,000.
It can't even really break even now because of all the mess that's out there that's not, so I agree with Commissioner Butts. If we gonna close transit, cause it's not making money, then close some other things that's not
Some other
making
things
money.
around here is not making money.
Yeah,
The transit is not
Now,
the
I
only
have,
thing.
is there anything regional that we can do to get us over this hump and go back and then figure out, I don't know.
So are you requesting that we shut down recreation?
Anything
Department?
that, we
Do
shut
you
down transit
request that
because
we
it's not
shut down
making money,
transit?
we shut down
What's the
anything in
difference?
Baldwin County
What's
that's
the-
not
I mean,
making
it's fine
money.
me. I mean,
I'm recommending we
difference?
shut it down.
Okay, so, I mean, the recommendation, it seems, is that we shut down the recreation department.
If we vote as
That's what
a
I'm hearing.
board to shut down transit, we need to bring up everything, we need a list of everything in Baldwin County that's not being sustainable and making money and shut it down also.
We definitely need that list.
Yeah.
Definitely,
Most of us know the list.
yeah.
I have a question for, the county manager. You ran the transit system in Putnam County.
Yes, sir.
Give me some of your thoughts on this right here.
My thoughts on this are irrelevant. I work for the Board of Commissioners. I do exactly what they say.
I work for the Board of Commissioners. We all work for the Board of Commissioners. That was on my paycheck, Board of Commissioners.
And that they get paid to set policy for this organization, not me.
So you can't give your,
Correct.
No,
we
no,
can't.
he can't do that.
okay.
It's not,
Yeah, him not being an elected
When they get
official,
through,
he
I'll
can't
get-
get into the politics.
Thank
of
you.
it.
wait till they
Thank you.
get through, I'll get you there. Anybody else have any more questions for Craig, for Mr. Pearson? And Miss, I forgot your last name.
Waller.
Swaller.
Miss Waller.
All of them.
Let's find a way. Let's find a way for the people.
Yeah.
I know it's frustrating to all of you.
And we really need to hear from the people as well, because I know they
Yeah.
need this.
Yeah.
I got a lot of people that
Yeah.
has been calling
They
me
need
asking.
this, and some of them can't come, but I'm sure they have family members that can come.
Mm-hmm.
And sometimes when you fighting for something and need something, you got to put a extra
Yeah.
step into it.
Right.
I have another question, and I don't know that anybody knows the answer to this, but Mr. Strickland, you were referring to, and Craig, you mentioned too, all right, people that are eligible for Medicaid that need to go to dialysis or some other medical treatment, can't we figure out a way that we charge them the Medicaid price or something rather than $3?
That's what it
Yeah.
would be. It would be whatever they would
Mm-hmm. Yeah,
pay.
it'll be whatever they
I
pay.
know they
And
charge
it-
more.
Yeah, it would be
transit
more
system-
than that,
How
yeah.
would we get into that?
That's like I said, that's a class that I need to attend so I can put it in the
that-
Is
system.
it
And
legally, I would have to ask the lawyer that, is it legally possible that we can use a Medicaid service on the county coexist together like that? Okay.
Do we already have a medical transport available that we don't have to provide? Would be a question. I don't know anything about.
Medical transports, I mean.
Non-emergency
all the
medical
time.
transport.
Okay.
It's
They have
a
a bunch
thing.
of them in town.
Okay.
But still have to pay.
Yeah, they
Yeah,
gotta
but,
be.
but they charge, so the way
I say
that,
we'd be out of it. They would.
outside
Right.
of this, the way that would work is that the provider, clears that and I won't say they receive payment prior to the ride, but basically they would file, they bill Medicaid. So you don't ever even bill the person never gets a bill. They bill Medicaid for the ride, they provide all the documentation, and then they're reimbursed for it. But they do verify that, of course, Medicaid's valid and all of those things prior to the ride. So this happens in the emergency world all the time. That's how ambulance billing goes, that, you know, if somebody has Medicaid, they don't get billed. That provider bills
Medicaid.
Medicaid. And that's how that would work. But we're, you know, I don't know that we can get in the non-emergency transport business.
We have to get a
and
license
bill-
to do that, a permit.
Yeah, we can.
Right.
That's a,
And then you
Not
have
viable.
some people, working people that's, you know, I guess middle or upper end class, they have insurances that pay for that. Because I remember way back in the 60s when I was 8 and 10 years old, my granddaddy had to go, they had to fly him to Tennessee to a cancer clinic, you know, and all that was paid for by some type of insurance that my grandmother had, you know. So it's other people with insurance that will also pay, but we just gotta have a way to provide this.
right.
I don't And I would have to ask the county manager and the attorney if it is even possible that we can get involved with our transit. And is there a template out there that any other county is doing that? I don't, running it through my head, I don't think we can even do this with, getting to the medical version with Medicaid and things.
But like she said, we
Right,
can
yeah.
use the card system, cause you say Washington
Right,
County.
right.
And I know, I think,
Yeah.
now if I'm not mistaken, Bibb County used some kind of cashless.
They do too.
Right, cashless, payment.
And you can have a
And like I
point of
said,
sale,
we're the
and
only
you'll
one
know
that
daily how
don't
much
do
money
it.
being collected daily.
Right, because they have an online system that you can pay before the driver come get you.
Well, this is gonna be my last question, statement I'm gonna say on this matter to you all is that, I don't know how this vote gonna go after y'all leave the podium, but if it don't go the way I wanted to go, I appreciate everything y'all did, and, it's gonna be a hurtful thing for me for to lose that transit though, but I'm gonna respect whatever the board vote on it, I'm gonna respect and move on. Hopefully one day if it do go, we'll be able to bring it back. I'm gonna keep the faith and hopefully it'll stay.
Thank you very much.
Thank
If
y'all.
y'all don't have anything, anybody else have any more questions or y'all don't
Yeah,
have
no,
any?
Let Mr. Trumbo, he
Right.
Oh, no, all I had to say was.
Can you come to the podium, Mr. Trumbull?
All I had to say is I mentioned that, well, first off, I want to tell the drivers, I am their supervisor, but, I can't be two places at once. I was told to be at the water park, so that's what I'm doing there. That's what Chief Adams said last time, is I wear many hats. And one of the big things that they said that I think is a good idea, but it'll kind of cost us, is going to cashless. I think that's a great idea because it does, just like at the water park, that was my idea to go cashless. So then, nothing as far as the money gets, mistakenly, nothing happens. Everything's correct. So that's why I did that. That's one of the, and then another reason was a safety thing, was so that, we're not holding cash out there on the middle of 22 to where someone could come out there and, try to rob some of the workers. Just for that. But my thing is with this, and that man right there, and he knows, Miss Craig. I'm trying my best not to get emotional because that man pretty much saved my aunt 10 years ago when he drove my aunt every day to GMC cafeteria every day. My Aunt Beverly White. He's the one that found her laying there passed out in her front room. Not only did he went above and beyond and took her to the hospital in the transit bus to where we found out she had cancer. So, my thing on why I'm saying that is that, I think it's needed, but I hear what you guys are saying. There is, I'm going to use probably the Scott Little analogy or whatever. Hey, if I got my truck needs fixing and I only have $400, it costs $1,000 to fix it, what do you do? But I look at it as, when there's a will, there's a way, and we can do it. And that's what I was telling Ms. Davis, this over there. I talked with the GDOT person, and they said there's a regional thing that can be done to where they work as a region to do the bus systems. I was told about that. Then also, I said this to Carlos last year when he was here. I mentioned an idea, just like Athens, just like UGA. I know we're not big as UGA, I get that. But I used an idea, I said, hey, tap in with Central Georgia Tech. Try a contract to where any Central Georgia Tech student can be picked up for free. But CGTC does a contract and pays the cost up front, just like I said, UGA does with the city of Athens and Clark County. So that's all I really had to say, unless y'all had anything for me.
I do have a question.
Yes, sir.
Viable suggestions there. Is it possible if, we're obviously hemorrhaging money here at the county. Ray Charles can see that. And, if we have to make a financial decision that, were to remove this service, is it possible to then, is it possible to restructure it, rebuild it, and, and then re-implement it with things that you're suggesting in place? Let's get all that in place, see what it looks like, I mean,
can
is that something that can be,
And rebuild anything.
No, I agree with that, but like Chief Adams said last time, you need someone there mainly, and actually they said that. You need that, you need someone mainly that's all they focus on is transit. I mean, other counties do it. I don't know if Paul, if he did it by himself up there in Putnam. I don't know. I don't, did you? Did you run the transit by yourself or did you have a manager there? Sir? There was someone there. Oh, okay. Well, see, so, and I agree, like I said with Chief Adams, someone has to be there to, just like the water park. Water park's a beast within itself. Someone has to be there all times to take care of that. Same thing with, like I said, with transit. Someone's got to be there, but I can't be at two places at one time. Not Superman. I wish I was.
but you're Captain America?
Yeah, I am Captain America. I say that, but no. I do believe in when there's a will, there's a way. That's just me, and I think this is needed. My aunt used it for years, and I get it. I understand the money thing, but like the old saying goes, there's more than one way to skin a cat. And yes, like you said, the restructuring, I think that would suffice.
And I think our county manager is working on restructuring some things and trying to make some things happen, give us a cash flow.
Now, I definitely do agree about the, as far as, if you guys decide to keep this or keep it going, find a way to do it to where there is no cash. And I know I got flack when I said no cash at the water park, but I did that for tons of reasons.
But you wasn't the only one that had said that. We all had thought about that.
I think the whole county should be cashed,
Yeah,
the water
yeah.
department,
Yeah.
everything.
Oh, okay. Well,
So we want
okay.
Question for Paul, maybe, is transit something that could be an enterprise fund? To where the
Oh,
money,
no. No, sir.
Okay.
That's,
It's just water.
gotcha. Thank you.
I don't,
I'm gonna make another comment too. Based on the numbers we had, and I believe, Van Holt said that 3,000 of these riders were from the city, which that's the majority of our riders. I still say that this ought to have, the city should have some responsibility to help provide a service for their citizens. And I mean, I don't know how we get the city to do that, but the city should step up and participate.
I think it's worth a try. I mean, I sent the numbers that Mr. Van Hout asked me to that he needed, and he got them.
And again, when I think about that, if the city, if this is such a needed service and if the majority of it's in the city and this city isn't excited to jump on it, could it be that it's not fiscally responsible?
like I say, I spoke with them and explained the numbers to them, and I don't think they're excited about it.
But you have.
You didn't get a-
You have to also understand, I think, that,
That's part of the SDS agreement too, so.
right, that's part of the SDS agreement. And if the city had wanted a transit, they would have a city transit. So evidently, and like I say, main thing is part of SDS.
And people in the city pay county taxes also,
Right,
so.
they pay city and county taxes. I know I
And that's
do.
part of our SDS, so.
Yeah.
So, Mr. Chairman, is there something that is legally preventing the city from participating in transit?
I would say no, but I'm not a lawyer, I would have to ask the
I
attorney.
don't know.
They could act.
Yeah.
We don't-
I believe that they could act at their next meeting.
Well, we can't make them do anything now, just like they can't make us do anything.
That's right.
So,
I
mean,
ask, and
you know.
hopefully they looking
I
at
agree.
this, it'll make it be just as important as it is to me and to us around this board, but only thing I can do is sit on Olive Branch out to them and ask them, y'all like to go on a joint venture with us? We tried that with a lot of things with the city I have, and people around this board have. Good luck.
I mean, we can't get mad with them because
Nah.
they won't. That's
I can
crazy,
only ask.
I'm not upset about it. I just don't.
Gotcha.
I know the service delivery strategy is a monster, but in my opinion, it's a weak excuse. I mean, to be frank, They could have a meeting. They could do this outside of service delivery if they wanted to. But the truth of it is, they just don't want to, which is unfortunate because the majority of this service takes place inside city limits.
Well, we haven't spoken with them regards to whether the majority of the services are. So we can't really say what they want to do or can do or can't do.
I thought the chairman indicated he had a
Right,
conversation.
I spoke with the mayor, so I don't wanna say what the response was at all.
Commissioner Chairman Butts, we have a young lady back there that's been had her
Right,
hand up.
well, I got it.
Did you
Plus, I
sign
got some
in?
people on the list also to speak.
Ma'am, do you work for transit?
No, I work for Innovative Bring Up Care. I want to speak on behalf of my patients who utilize the service.
Okay, well, if anybody don't have any, more questions from Mr. Turmo, you can come up here. Do y'all have any more questions? No, sir. All right, thank you.
Okay, well, I did, one of the drivers wanted me to read something if that was okay. Is that okay? Or you want to wait till after she gets done?
No, go ahead.
Okay. There's one of the drivers named William Goddard. He wrote this. He sent it to me this morning because I guess he can't be where he's driving. But he said, I come today with a heart so pure, not only as a transit worker, but more of a concerned citizen of Millersville. I understand the significance and impact of the service delivered by Baldwin County Public Transit to our local community, a county that is known for its rich and beautiful history. It has been 1 year and 8 months that I consider myself blessed to serve our passengers. As time goes by, these passengers are no longer my clients, but they became a part of me being and considering them as my family. The relationship turned into a friend, a cousin, a brother, a sister, an auntie, an uncle, a father, a mother, and grandparents. It was no longer feeling like a job or a typical ride, but instead a passion to serve them. We may be facing challenges right now, but let us not give up on these people who are depending on us for a ride. A simple ride that would bring them to a grocery store so that they could prepare a meal for their family for dinner or to a dialysis clinic, hoping they would live longer and spend more time with their loved ones. It may seem like a small gesture to our eyes, but for them it really means a lot. No matter one's walk of life on our rides, the only thing that matters to me was the fact that humanity exists. These heartfelt words are not being spoken to save transit, but more of to save hope, faith, lives, and family. Thanks to all that still holds believe and love for our family in Millersville, Baldwin County. I appreciate you all for taking time to read my letter. Sincerely, William Goddard. Thanks. That's all. Yeah.
Ma'am, you may come up.
Police on another one.
Just state your name, if you don't mind.
Good morning. My name is Kristen Lewis. I'm a licensed clinical social worker at Innovative Renal Care that's on North Columbia Street, here on behalf of the Millersville Clinic and the Baldwin Clinic. One of my patients called me on the floor this morning and told me that this meeting was happening at 11 o'clock and asked me to come and speak on their behalf. Most of my patients that come on transit are ones who do not qualify for Medicaid. So these are the ones who are not bed-bound, which would be like EMS, where the insurance could pay, United Healthcare, Medicare, the Advantage plans. They're the ones who are over the income for Medicaid. So they need Baldwin Transit, they need Hancock Transit, they need Putnam County Transit to bring them in for services. So thank you for giving me the opportunity to speak. For most of us, transportation is simply a way to get from one place to another. But for someone receiving dialysis, transportation is the difference between getting the treatment they need to stay alive and missing it. Patients with kidney failure typically receive dialysis 3 times a week, every week. Missing even one treatment can cause serious complications, including difficulty breathing, dangerously high potassium levels, hospitalizations, and in some cases, death. Many of our patients are elderly, disabled, or living on fixed incomes. They don't drive. Many may not have family members who can take them to and from every appointment, and many can't afford private transportations several times a week. For them, county transit isn't a convenience, it's their lifeline. As a dialysis social worker, I've had the privilege of getting to know these patients and their families. I firsthand saw how hard they fight just to stay healthy. They already carry the burden of living with a chronic illness, and they shouldn't have to worry about whether they can have a ride to and from treatments that can keep them alive. This isn't just about transportation. It's about keeping our neighbors healthy and giving them the opportunity to live. When someone misses a ride to the grocery store, it can mean just missing a meal. But when someone misses a ride to dialysis, this may mean they missed the chance to live. Please don't let transportation be the reason someone loses that chance. I do understand there is a financial burden, but I'm a social worker and I advocate for my patients. I ask you today to think about the people behind the numbers. These are mothers, fathers, grandparents, veterans, friends, and long-term members of our community. They're doing everything they can to manage the disease that they did not choose. The least we can do is help make sure they can get the treatment that keeps them alive. I want to speak on, I made some notes about you guys mentioning getting on maybe the contract with Medicaid. So we currently use a company called Verida. So most of our dialysis patients come via transit or they come from Medicaid, but they have to qualify to get here through that. The companies that are contracted through Medicaid that brings my patients to
We
dialysis.
usually give you 3 minutes, but I think
Oh,
this is very important.
It is, I'm so sorry, I'm sorry. They are not reliable.
No, you fine. Just whatever.
I can, when I call to set up transport for my patients that are Medicaid funded and that's how they come in, I can say the patients live in Baldwin County, they are requesting this transit. That will give them the opportunity, and that's gonna be guaranteed trips, because the ones that I have that are bringing my patients now, they aren't reliable. We have several hospital readmissions because transport is not coming. They're just not reliable. If there's any resources I can provide to you guys, if that's something that you're interested in, I don't mind helping do that. I know Shanerica mentioned other counties may have the where they can have the cards. If there's something that I can do where I have my patients who are coming on transit that would help make sure that the money gets to you guys before they come, I don't mind doing that. I have patients now that wanted to come and advocate, but they are on the machine now. I don't know what they're gonna do if transit is not available for them. This is not enough time for them to, for me, the burden is gonna come on me as well. I can't get in my car and go get all of them, which I'm sure that wouldn't be the ethical thing to do, but morally, that's what I would feel I would need to do. So this is not enough time for them to make arrangements. This is a 3-day-a-week treatment that they have to have that's life-saving. So I just ask, when you're making these decisions, please just consider my dialysis patients. There are other dialysis centers in this county, not just Innovative Renal. So I don't know the numbers for the other dialysis centers that are utilizing you guys. But this is not enough time for them to make these decisions and make these changes, and me to help them, because Medicaid, they're not a candidate for. So I can't put them on Verida and say, hey, can we pick this patient up? A lot of the ones that come, they are not bed-bound. They are not total care. They can ambulate to the truck. They can wheel to the truck. So they won't be a candidate for Southeast Ambulance or Life Care EMS. They won't be a candidate for that. So I'm really concerned about what my patients are going to do between my 2 clinics when it's time for them to get to treatment this week and moving forward. Transit has always been reliable. Like I said, I work with most of all of the transit companies here. They are the ones that I can call on when I need them. The other ones, I have to rely through a portal, Verida, for Medicare or Medicaid, and they just aren't reliable sometimes. So here on behalf of my patients, and I just ask that you please consider.
Okay, do you have a card that you can leave with us? So
I
if we
don't.
do decide to go classes or whatever, we can contact you.
Is there, somebody tell me to sign in? Was I supposed to sign in
No,
somewhere?
just give the clerk your information,
I sure will.
and then we'll know how to contact you.
Okay, any questions?
I don't have any.
I
Thank
do,
you.
Mr. Chairman.
Thank you, okay.
Yeah, I have a question for you. So I know we don't know this number, how many patients you have that don't qualify for Medicaid or I guess Medicare won't pay for the service. But, maybe it's a big number. I don't know how many patients you guys see a day.
So I have about 70 to 79 patients at Milledgeville, and the Baldwin Clinic has about 39. So they're either a Monday, Wednesday, Friday, or a Tuesday, Thursday, Saturday. So they are coming weekly, 3
Okay.
days.
So I know, I'm in the medical field. I know there's money in the medical field. I know you're not gonna be able to answer this, but would your company be interested in paying for these riders?
Well, so that would be a attorney type question. I could speak with my supervisor to pose that question, to see if they would, but
I guess my point
yeah,
is.
I'm really not certain.
My point is that you're charging these patients for dialysis.
Their insurance is paying.
Well,
I'm a social worker. I
Somebody's-
don't work in the
but- okay,
administration.
But there is a lot of money changing hands in the
Sure.
medical field. It doesn't matter if it's dialysis, the emergency room, admissions, ambulance service. I mean, there's a lot of money in the medical field being tossed around. My point is, if this means that much to your business model, then consider paying for the transportation so that it's not on your patients anymore. And it just has to be weighed. And I mean, I know everybody's working on their margins. That's why we're having this discussion.
I understand.
But it's something worth considering. I know you don't need to answer that. You can't answer that. It's gonna take a while to figure it out. But it's worth thinking about.
But too, like everybody else was saying, if there are things in this county that aren't benefiting or making money, why can't this be something as well? I can only speak to my dialysis patients. I don't know what other patients in this county utilize the services for. It could be people getting to the grocery store, or I do have wound care patients that have wound clinic appointments. I have that as well. So I don't know who else uses the service. I'm here advocating for my dialysis patients because I don't know what they're gonna do if transit stops. Like I said, this is not enough time to help them prepare for this.
And to piggyback off, you're a social worker, you're not a CFO of a company.
Not at
You
all.
do
I'm
the
here to
daily
advocate
operations
on
what it
behalf of
costs
what I
them.
see, absolutely. So when there are financial barriers, I can provide resources, but if there's not a resource, what can I do? They don't qualify for EMS transport, they don't qualify for Medicaid to come that way, but they can afford what Baldwin County is charging for the transit, that is what they do. The family members, like I think another county, do y'all do weekends too, or is that not? Okay, so there are patients who, because we don't work on Saturdays, they have to find a way to get here, whether it's cab or whatnot. Or, during the week, family members are working. Sometimes people don't have the supports that everybody has. People aren't
Right.
privileged in ways that others are. So they are already dealing with this chronic illness, which is already hard enough. And to add transportation to that as a barrier, I think it would be devastating for them. It's gonna be life-changing for them. So I just ask that you guys consider.
Anybody have any more questions?
Thank you.
Thank you.
Thank you, ma'am. Don't
And make
forget
sure
to
you give
leave
the
your
clerk all your
information.
information.
Thank you.
All right, we got 4 more people want to speak. Mr. Young, you still want to speak? Okay. You good?
Yeah, I want to speak restroom.
You want to speak? Oh, come on.
Well, my name is Victor Young. I'm to the commissioners, Mr. Chairman, the commissioners. My name is Victor Young. I'm the former fire chief here. I'm the former transit director as well. I'm the former safety coordinator. I'm here to discuss about transit. Transit is a valuable part for our community. And to dissolve transit would be a sad day for Baldwin County. I ran transit for a long period of time when I was at the fire department. And by me running transit, we didn't have a whole lot of issues that I'm hearing now. And I'm so surprised to see what's happening so quickly. And I've just been retired less than a year and a half, 2 years, to see that we're going through what we're going through now. Transit provides services not only for the blacks, white, and Hispanics. There was something that we had to do with Q-Ride. Every month, they had to state how many blacks ride, how many whites ride, how many Hispanic rode this. And on the defense of Mr. Trumon, I'm not sure was he properly trained about a lot of stuff that came with transit. By me being a director, I was in charge of the audit part on the operation side, and there was an audit part on the business side that the finance had to do. Being the fire chief, I had to rely on Chief Adams to handle a lot of my the fire department duties because transit is so important because the GDOT kept changing the rules, how we had to do this, how we had to do this. So therefore, I had to focus on transit. By me focusing on transit, I'm going back to the audit. I got an audit every year from the auditor from transit. I had to do mock trainings. I had to make sure all my guys were trained every month, every year on drug and alcohol. I had to take classes up in Forsyth every year. In my office, I had to keep a locked box for every personnel that worked for me. And so when the auditor came in, she had to go check my box, make sure everything was correctly, that everything was provided like it's supposed to be provided for. And so therefore, with the grant process, the finances was not in place. If my part was not in place, therefore we would lose the grant. So I'm not sure that Ms. Trabone did he deal with the auditor or the person that does our community? If he did not do this, yes, we're gonna lose the grant. Same thing as being a safety coordinator here for Baldwin County, I had to do the same.
You make it.
The same thing as a safety coordinator. We're gonna lose our insurance for the county if the safety coordinator did not have meetings as well. I'm not changing the story, but it's the same thing. Our insurance probably gonna go up because we don't have a safety coordinator. I'm not sure we have one or not, but this had to be done. But going back to transit, if we lose transit, our fire response will increase. Our ambulance service gonna end up increasing. And our mortician job will increase. Gonna be a lot of dead folks. That's no doubt about it. Because we're dealing with a lot of dialysis patients, a lot of cancer patients that we had to pick up every day. I heard you talk about the manifest. The manifest, every Monday, every day, all my staff came in and brought the money in and counted the money every day, daily. It was done daily. Then they put it in the envelope and they put it in a box. Every day, 3 vans, how many vans it was, 3 or 4 vans, but the money was brought in daily. The young lady that I had running transit, I made sure she went to the classes. I made sure she knew how to do the Q-Ride, make sure all the data was put in properly. I had a hands-on with it because I cared about it. If you don't care about it, you're not going to make the thing succeed. And I cared about it because this is my community. But I made sure that each personnel, like I said, had the training and did what they had to do. And all the data was put in. Every Monday, I used to bring the money to the courthouse, to here, and make sure, or myself or Chief Adams used to bring the money here every Monday as they reconcile the money part of it. There has to be 3 or 4 signatures before I counted the money myself. My secretary, Tanya Drinkwater, counted the money herself, and we brought the money here to the government building. So that was done on Monday or Tuesday. But daily, going back to daily, they brought their money in. Was it a lot of money coming in every day? No. It probably, one van may brought in $50, $60, $70 or less. It really depends. There was cancellation. And that part, my dispatcher handled that. Miss Waller, she came in late on. She was a driver. Then she came on later on after I left. I'm not sure what happened after that. But the person that I had, I made sure she got all the training that she needed. I would provide it for her, but I was hands-on. Mr. Trombone, once again, if you're doing 3 or 4 jobs, you cannot be efficient with transit. You're going to have to stay focused with transit to make it be a viable commodity for Baldwin County. I look at transit same way I look at the fire department, same way I look at the ambulance service. Fire department had a budget. The ambulance service had their own budget. If transit had its own budget and we did not depend on GDOT, we'd probably be a whole lot better than we are. We would have had more regional going out of town or do what we need to do. There's no money. $3 back then when I was doing it, was $2. $2. You can't even put a tank of gas for $2 no more. But we got it set at $2 when I was running it. But in defense, I'm not sure. Once again, Mr. Tremble, I don't think he had all the training. He was put in a position, don't have the training, you're not gonna succeed. You're doomed to fail. I had to learn it myself. You know, I taught Chief Adams as much as I knew about it. You know, I hope he taught Mr. Trabone as much, and I don't know, I can't speak for that. But I do know for a fact that you have to be there every day. You got to make sure that you deal with auditors, a yearly base. The maintenance has to be done. Training has to be done. I know I'm repeating myself, but I want to make sure we're hearing this, that all this has to be done. And if we do not do this part, we will fail. And this is probably what don't happen when it came to the audit. We did not do the operation part, didn't do it. I'm not sure Mr. Tremont went to the mock training at Dr. Stevens' office. That has to be done every year. If it was not done, we're doomed to fail. And I dealt with my manager, Carlos at the time. If he did not provide information, I'm sorry for that, because I dealt with him. But that's what had to be done every year. I even took Jeffrey Adams with me to do the mock drills. And he can testify all this had to be done. So,
Sounds like you took the initiative to do your job and do it well.
yes, ma'am, I took
Okay.
initiative. I
You took
love
the
what I
initiative.
did.
Yeah, you took the initiative. Okay.
But if anybody don't have any questions, thank you. Are you through, Mr. Young?
I'm fair. Any
Okay.
question I can
Anybody have
answer?
any questions for Mr. Young? Thank you.
Thank you, appreciate you.
Next on the list is David Dudley, so I don't see him in here, so I think he left. Next one will be Adam Stern.
Good morning.
Good morning.
Name is Adam Stern, 1806 Tanglewood. So I'm going to start with the perception here. My perception of the situation as it exists is that up until this point, it seems like from an administrative perspective, from an operational perspective, the transit system has been run as best it can be, but from an administrative perspective, it's been almost operated as kind of an afterthought. The resources haven't really been put in to build out a strong transit system. And so that the fact that it's been working as well as it has is actually a testament to the people operating it. There are a few things that I found when I was looking into our transit system. Not a lot of just out in the open, on the open internet information about it, but according to the 2023 Baldwin County Joint Comprehensive Plan, our transportation system is funded by Federal Transportation Administration Section 5311 grants, which are rural transportation. They're formula-based rural transportation funding, but we are primarily using it to move people to doctor's appointments, which would actually possibly fall more under the 5310 funding scheme, which is enhanced mobility of seniors and individuals with disabilities. So there's an entire another pot of money that we could potentially be trying to run for operating like a parallel transportation systems. It's not, and both of those programs are passed through. They're federal pots of money that are passed through the Central Georgia Regional Commission, which we all kick money into. It's like the county kicks money into it, the city kicks money into it, and so it is a potential pot of money for being able to do these things. The other thing that you can do with a 5310, Section 5310, is what's called a mobility management program, which is you're not actually moving people, but it's an office that connects people to resources, which is exactly the kind of thing that we've been talking about as far as like we have other mobility, we have other transportation options. So it's a question of what fundamentally the problem that we're having is that we have a lot of information. We don't really have a clear idea of what the information landscape looks like. And so one thing I would like to put forward to you is that many of you are familiar with my background. I actually applied for a job here not that long ago. I would like to propose that I would offer my services on a volunteer basis to actually be a person to analyze the information, analyze the information, and provide actionable policy options that we could potentially utilize to make this system, A, save the system, B, make it stronger, and C, actually make it a economic advantage to the county. Because one thing that we're dealing with is that we have all of these grand schemes for utilization of our county cultural resources, for our county recreational resources, but we don't necessarily have a transportation system that would properly support that. So I would like to put that forward as a possibility.
Get with the county manager, give him your information, and if it's something he deemed that we are able to do, he'll let the board know. He'll let the board know. If you don't mind doing that, Paul, if that's a deal, just give him your information and he'll talk with us and give it to us and let us, if he think it's something that we are able to do in this county.
Thank you very much.
Thank you. And the last on the list is Ms. Waller. You want to speak again, or?
Oh, no.
Okay. Okay. Well, that's it. Do anybody else around the board have anything to say on this issue? I entertain a motion to decide whatever y'all want to do with the transit. I entertain a motion. If I could make the motion, I would make it, but you can. Well, I entertain a motion that we continue running the transit till we figure it out, till we figure out what the options we need to do. And I'm only available for they go up on there. I've been giving the number from 5 to 8, whatever number that's gonna make us sustain and able to provide this service to this county. I'm okay with it. I would hate to do that though, but if that's my compromise, to go up so we can break even with this.
Second, Mr. Chairman.
Okay. Well, any more discussion? Well, I'll make the vote that we go up to $8. $8. I think the numbers that would allow us to at least break even with this transit.
But am I hearing two different motions? Because we don't need, you want all that in one motion, or we
Yes,
want to
all of
discuss
them
that later?
All of
The
them one
amount
motion. All of them one motion.
Later, or?
No, hey, we need to do this now. We need to do this now. We don't need to keep kicking this ball down the road. So my motion would be to consider keeping the transit with an $8 bill, the $8 charge. I've been gave me them numbers, and I think that would break even. We would break even with the transit.
Okay, second.
So that was $8 per trip?
Yes. The motion that have been properly second. Any discussion?
Yes, sir. Paul, how do you feel like this number shake out?
I'm trying to figure out, in Mr. Trumbo's email, that was 5,100 trips year to date. So the beginning of this month, it was 5,100 trips total. And then in the previous discussion, with the revenue that was received by Ms. Dana, that was $7,500 at $3 a trip, which equated to 2,500 trips was the money we received. So from at that point in time, so the numbers are all over the place with the amount of funding we received. Yes, we did receive $7,500 in the beginning of the month, but that was through January to that point in time. And now we have 5,100 trips, but it was the same thing from January 1st to the point in time when we got that. So it's not 5,100 trips a month. That was 5,100 trips or 2,500 trips year to date, which was
So
earlier in the month.
What, 5 months, or how many months?
It was 6 months.
6 months.
And so that would put us on track for 5,000 trips. If we just doubled that number for the sake of conversation, and that would total
That-
$40,000 for the year.
That's what I was thinking, if you
And that's
just double the
just-
number. you
So
get the
we're
annual.
making a month worth of what it cost. At
At
$8.
$8.
At $8 a trip.
You gotta have about $4,000 to $5,000, 5,000 people a month to make it work.
Do we have the
And-
numbers of how monthly, how many people that we are moving through transit in Baldwin County? Those are numbers I would like to see and have.
Mr. Chairman, may I? Maybe, since we having this extra discussion, we may need to get more numbers, give the county manager a little more time to research with different things, and we, take this vote on Tuesday, our regular meeting?
I think that's a good idea, so I will send my motion and to Tuesday night, and you get us those numbers. Don't let someone else around this board have a motion they wanna make, but I will is that,
I think it would be helpful if we had a dollar figure.
Yeah.
You know, to say, okay, at $8, we need this number of people to ride to make it pay for itself.
and give us
You
a,
know, and then we can decide, and then we could do another 30 days and see if we can get that many riders,
okay,
if we can't, we can't, you know, we're done.
right.
And I do think also, Mr. Chairman, that bumping it up, because $8 is more than half of what they're paying now.
It costs what it costs.
Yeah, I know, I understand that, but that's why we need to wait a minute, not move too fast and get the numbers.
Well, I'd have rescinded my motion, so I'd rescinded my motion till we get this information into Tuesday night.
So I just want to make sure I understand. I believe I can pull the information together. So we basically have 5 buses and dispatcher, manager, all the insurance, all the fuel, and I'm going to have to figure that with no grant. Is that
Right.
the question you're asking?
Right.
Figure out what
And-
those costs are with no grant based on the revenue that we have received. It'll be up through the end of July, I would imagine we'll have some of those
So
numbers.
Chairman Butts rescinded his motion, but did I hear Commissioner Howell make a motion to extend it another 30 days? What did you
didn't
say?
give me make that motion.
But what did you say about another 30
Said
days?
I
Tuesday
just
night.
said we need to have some figures, and if we get those figures and we decide to go forward, at that point, we might consider another 30
Okay.
days. But I mean, I'm not ready to say another 30 days without more information.
Commissioner Hall, I would challenge, that's what the last 30 days were supposed to be for.
I thought so too.
And I would make a motion that we don't continue with transit.
Second.
Any discussion? Hey, I'll be sounding like I'm repeating myself. Y'all around this board and this community know how I feel about transit. If nobody don't have any more discussion about it. All in favor?
Aye.
No,
All,
I vote aye.
okay. All opposed?
no.
No. Motion passes. As of today, we have no transit. Okay,
we have
thank
no-
y'all. Thank everyone that came and spoke. Thank you all. Next item on the agenda will be the audit.
Yes, sir. We have an engagement letter from Ms. Garcia with the firm of Butler, Williams, Weiss, and they are your accountants. So for the 2024 audit, in light of everything that's happened, she is requesting an addendum to her contract to bill for more hours to get the audit finished. We don't know exactly what that's going to be, and I will share with you what the conversation I had with her was, and I asked her point blank, is this a $5,000 problem or a $10,000 problem? And she couldn't give me an answer because of the independent nature of her audit. We have graduated to what's called the yellow book in GASB standards, and that is the naughty list of accounting. Our internal controls and a couple other things have been less than stellar, and this has elevated us to a whole new level of scrutiny. That scrutiny takes time and money. And to be quite honest, I don't know what y'all had before. I've heard stories that, yes, we paid for an audit, it would have been done in time, it would have been great. However, it's not. And what that translates into what Baldwin is experiencing today is we just lost $850,000 in LMIG money. We got to have the audit done. At this point in time, we gotta move heaven and earth to do so, because the next audit, which is 2025, with the Symphona law firm out of Dublin, that's gonna take 6 months to do also. And then guess what happens in 6 months? The 26 audit is right on top of it. So if we start tripping and delaying this even more, there's no telling when we may get grants again from the state. We're in that kind of trouble to just, I can't give you an exact answer. This lady's saying it's gonna take time. So we just gotta do it and bite the bullet and move forward and let this auditor finish and wrap up. Sorry for the bad news.
Paul, do we have anything in place that we'll never allow an auditor to do this to us again in Baldwin County?
Auditors are independent on purpose, so you can't influence them. They are, by their job, guaranteed that autonomy and independence to provide a fair, clean opinion. So, no, and honestly, if you were an accountant from the outside and you had to look at your books after everything you went through, wouldn't you be a little more deliberate in your work? And the answer is, of course.
Yeah, I feel like we should have been doing it. On the
So-
day one when I came in office, though, but that's another.
Yeah, it's an ugly matter because it is such an unknown, but we have to have that fair, independent
I
opinion, and we
understand.
gotta get a clean opinion when we're done.
I totally understand and agree with you. Anybody else have any question for Paul?
Motion to approve.
Well,
Second, discussion?
my concern is, I hear what you're saying, Paul, about it's dire, we need it. And, I won't necessarily disagree. My concern is I believe we've already paid for an audit that we did not receive on time. And if we had received that audit on time, then we would not be in this position. If they'd have done their job the first time, then we wouldn't be in this position to pony up more money to pay them to do the job that we've already paid them for.
Just as Paul stated, I get that, but we in a, hey, that's water under the bridge right there. It's time, we gotta move forward, though. It's gonna keep,
No, I understand, Commissioner Little. I mean, I really do. It's quite frustrating to realize you paid for something and you didn't get it. And ifs, wishes, buts, who knows what
Right.
happened back in the day of why it wasn't, nobody ever pulled the trigger to cancel the contract, to find another auditor, to hold them to a standard, to saying we're getting rid of you for poor performance. I just gotta know, I mean, I hate the fact that we lost LMIG money. I really do.
Are we handing them a
trust
blank
me, I
check?
hate it.
Yeah,
Is that, I mean, are we basically handing them a blank check and go do your thing and?
so, yeah.
fill in
it's-
the number.
but Again, this is just an ugly decision we gotta make so I can move forward with 2025.
Because if we have to go get another auditor, it might be another 6 months before we get 2024 auditor.
Yeah,
So,
and I respect that position we're
But
in.
we already have a motion, we in discussion though, but,
can it just be clarified exactly what we're voting on?
to allow the funds for I take it as to allow the funds for the auditor to
Okay.
finish, complete the 2024.
It is to
audit.
authorize the staff to sign the addendum to the audit engagement letter dated June 30th, 2026.
Okay.
And part of that, they have
Which
to
I
have
have here.
somebody to sign off on it, and that would be
So they
Paul
gonna
and Dana.
finish 24
Correct.
on
The
it,
previous
Okay.
signers are no longer here.
Correct.
So
I guess.
just to clarify, it's,
No, I think it's to complete.
we're gonna get a bill, we don't know what it'll
26
be.
on it?
Correct.
Okay, I'm with you.
25. Right, this is-
Cause it depends on how many hours that they have to do it with, so I get it and understand. Do we know what a dollar amount that they charge us per hour to do this?
No, I asked her if it was a $5,000 problem or a $10,000 problem, and she didn't answer. So she didn't know. Now, I will tell you, I have committed you guys to additional training as part of some of the corrective measures, that if and when you take classes, you'll be taking classes in revenue and finance when you go to ACCG, sorry. So then if you had them, you'll take them. But that's part of the corrective measures that we gotta put forward for the auditors to make sure this doesn't happen again.
And
Yeah, I
this
think
will
I
be-
got mine last year in my core,
And this will be for
Well,
the
you can go for
20
specialty revenue and finance, that's really
after I
fun.
do my core.
This will be the 24 audit,
Yes.
to complete the 24 audit.
Yes, ma'am.
Do anybody have any more discussion? All in favor?
Aye.
Aye. Any opposed? Pass unanimous vote. The next item on the agenda is 134 Stevens Drive.
Yes, sir. This is to surplus this tract of land. We have a fair market appraisal, and we have the title work done. The reserve put forward in this surplus property will be $450,000. The appraisal number is about $390,000.
So move, Mr. Chairman.
Second.
Any discussion? All in favor?
Aye.
Aye. All opposed? Vote, it passes
Sell,
unanimously.
Mortimer, sell.
Before I adjourn, I would like to ask you a question, Paul. As the first motion, we no longer have a transit. Where do we go from here? Do they have to turn, we're gonna have to turn the
Well-
vans in? What about the 5 employees?
I will look at trying
Can you
to
get us something, when you, and I didn't mean to cut you off.
try to do something with all that, then we got paperwork to do.
Will you email all the commissioners and let us know what is gonna be our action plan from now on, what it's gonna consist of? And when will it be the last day for those people to be out there in transit? It should be today, I'm guessing and assuming.
Yeah, today's the 28th, yes,
So
sir.
I hope they'll get at the end of the closing business today, that they will no longer have transit.
Okay, yeah, we don't want to leave anybody hanging if that's what you're,
Yeah.
I don't want to leave
And-
anybody orphaned at a
Right,
site.
right.
And Paul, to piggyback on the chairman, we voted originally to extend it 30 days. So is there another day or
The
so?
30 days was actually August 1st.
Yeah. it'll
Yeah.
Okay,
be-
so beginning August the first.
Yeah, that's what I mean.
Well, August
Yeah.
1st is Saturday, so it'll be Friday.
Okay.
Okay, I didn't think about it. Thank you
Yeah,
for
yes.
reminding me of that.
If you would, Mr. Chairman, just one quick indulgence. This is such good news. Commissioner Hall sat in on my staff meeting this morning, and the folks in the tax assessor's office just got their preliminary sales tax ratio study. They got a 38.01. So it's up over 3 points, which according to the folks in that office, that would create a 10% increase in the tax digest. So, not that all was bad news today. We got a good news at 10 o'clock, and I just couldn't wait to share it with y'all.
10%
That's good.
increase in the digest is, do you know
And that'll
yet
be-
on how much the millage rate?
Not yet. I don't know what exemptions he has on the other side of it. I was just happy we got a 38.01 because that means we won't get fined by the state $5 a parcel for,
And also, they should qualify us for all our public commissioner,
So-
money coming in too, right?
Public utility?
You're right.
I'm excited. So thank
I
God, we
am
got
too.
good news.
We can get public utility at the 40%.
Yeah, and I believe,
Okay.
That'd be great.
I hadn't seen that number yet, but yes, I know he's got a couple other ones on.
Mr. Chairman, before we adjourn, I'd like to say something. I don't know if now is appropriate or not.
Yes, go ahead.
Just a couple of things. One of them is the grass cutting in the 4th District is not, it's awful. So I'm not sure, I don't know how y'all's districts are, but.
Same
It's
way.
awful. It's
Add-
awful.
add
It's
District
awful.
2 to that list also.
It's awful.
So.
I called Andrew yesterday, I said, man. you
Yeah,
gotta look.
I guess what I'm suggesting here is that a formal process be put in place where somebody goes and checks behind these folks, signs off on a piece of paper. Before these people ever get paid, we make sure that they're doing a job that's quality and all this and that and the other. I've conveyed this to the county manager. Hopefully somebody will be tasked with that responsibility. I don't know. And then additionally, in my district, we're having, part of the new trash service with Ryland, we'll have a pickup on Monday. There's a lot of residents who voice concerns about this. Some VRBOs are out that way, East Lake area, across the river. And they're concerned that these folks are gonna leave their trash out. They're gonna put it out on, I'm sorry, it comes on Friday. So it comes on Friday, so these VRBOers will leave on Sunday and leave trash out there all week. Jay has been wonderful in dealing with some of this, but he's come up with an alternative plan. I just want to share that so everybody knows. But there's anybody who's eligible for backdoor service, there'll be a smaller truck that he's going to run on Tuesdays to help make sure that these places are cleaned up. It spurred a bunch of questions though about who's eligible, how are you going to figure this out? And what we've come up with, and I hope the board's amicable to this, if they have a VRBO license established through the county, then they'll be eligible for the Tuesday pickup. If they produce that to Ryland, then Ryland will get their address for the Tuesday pickup. If they have a VRBO license established through the county, then they'll be eligible for the Tuesday pickup. If they produce that to Ryland, then Ryland will get their address for the Tuesday pickup. all other residents can either use a convenience center if they're a weekender, or just, they won't have as much trash as a VRBO. So anyway, it's just something going on in the fourth district. I don't think it impacts anybody else, but I just want to make everybody aware of that. And hopefully, that sounds okay with you all.
So we
You
have,
probably got some, you would have some.
But his pickup day's on Tuesday.
Okay.
yeah, we have a lot of backdoor pickups in the county. So, yeah, so just make sure you have that list from somewhere, but people won't have to do all that again.
Medical-wise, it's only 136,
Yeah, I think the water department gives up on that.
medical-wise.
Yeah.
Okay.
Now, as far as otherwise, backdoor, there is like 800 and something of them out there that they would have to pay for. The medical is not, it's covered up under the plan, but the other 803 that they got sent to us is not covered under that, because there's no medical form on it.
They'll have to have a medical form to get.
It has to have a doctor to sign off on it to get it. We have 136 of those in the county right now, that is legit. The others that Waste Management, Advance, everybody's been picking up over the years are not. These are long driveways. People that just don't want to take their trash out, they are paying extra for it. That's the 803 that has been sent to us.
Okay.
And, cause I know a couple that's up in their 90s, they can't, and their son just recently passed away, so they can't get their trash. And they may not have anything necessarily quote unquote medical, but just being 95 and 98, really? Okay, okay.
That qualifies, doesn't it?
Yes,
Yeah.
they qualify. All they need is form, like I've been talking to Miss Patty, she gave me a big folder of all the medical forms that have been sent out. That's the county rule, is to have that. That's what qualifies them, so they don't have to pay no extra money, no nothing for backdoor service.
Does anyone have anything else before I entertain a motion to adjourn?
Move with John.
Second.
All in favor?
Aye.
All opposed? Pass unanimously. Vote will now adjourn. Y'all broke.